are Group 3 and we will be presenting on toxicology tests.
I am Brianna Nicole Anderson and I'll be presenting on the preparation of the patient.
I am Tatiana Seaton and I will be explaining how the test is done.
I am Erica Dyer and I will be presenting on handling of samples.
I am Patricia Williams Anderson and I will be presenting on interpreting the results.
I am Khadija Graphics and I will be presenting on significance to health.
A toxicology screen is a test that is used to determine the amount of legal or illegal drugs in the body. This test is done to determine if an individual is taking drugs that could endanger their health or if they were exposed to any harmful chemicals.
Today, we will focus on 3 major tests: the 12-panel urine test, the hair follicle test, and the oral fluid test, with focus on 3 major drugs: marijuana, ecstasy, and cocaine.
Give me a break, baby.
Afternoon, nurse.
Come
Good
here.
afternoon.
This boy give me PA trouble. Dismiss himself from school without even a subject. Now me I try get him in the art inferior medical. Now he make me them send me a lab where me not even know about. Him, everything him see him smoke. PA date me have with him, so them give me some lab tests to do.
Okay,
So
mom.
ease yourself, my man. Because I'm not nothing already.
Okay, there's no need for that behavior in this office. Okay, mommy, I just needed to calm down. Let us take a look at the paper. You may have a seat.
Sit down, man. Be attitude.
Can you get your name?
Erica.
Okay, Miss Erica, so it's apparent that your son will be doing a toxicology test.
Hear them now. Big word. I want that they miss.
Okay, well, a toxicology test is a drug screen that tests for illegal drugs or substances in the body. And on this, I am seeing that you'll be doing 3 types of tests: a urine analysis, 12 panel, a hair testing, and a oral fluid test.
I will leave her sitting there.
Yes, it's so.
And them sitting there put me through.
Mommy,
Ease yourself, my man.
Okay, please calm down. So the first one that you will be doing is a urine screen, which is a 12 panel. So first thing, young man, your name please?
David.
Okay, David, so a 12 panel urine screen, so I'm going to prepare you to do that test. First thing I'm going to ask, are you on any medication?
No.
Are you sure?
Sure.
Okay. Okay, so I'm going to need you to empty your pockets, remove any excess clothing and items such as bags and coats, and then I'm going to ask you to clean your hands before going to the technician.
No, nothing in my pocket, miss. Nothing at all.
Well, you have to ensure and check because it's better to be safe than sorry. Can you remove your hoodie, please? Can you come closer, please?
Come next to that woman. I want to see
Come on, David.
Okay, the next test we'll be doing is the hair testing. Have you recently dyed your hair or anything?
No.
Okay, that's very good. So, have you used any chemical in your hair recently?
No.
Good. So all of that is really, really important. So if you have done so, please be truthful from now.
I have not.
Okay, good. So are you taking any prescribed medications?
I look mad to you.
Okay.
Come on, David.
I'm sorry.
Please remove back the sweat. I need to observe your hair a little more. Okay. Have you been exposed to any drug or alcohol?
Not what I know.
Okay. So the next test you'll be doing is the oral fluid. Have you used any mouthwash in the last 30 minutes?
What kind of question that you ask me, woman? No.
Because if so, it can affect the results of the test. And lastly, before you go, the 12 panel urine screen test for 12 different substances, and the oral fluid test tests for 5 different substances. So please take this to the lab technician. Here you go, Miss Erica.
Thank you.
The lab is this way.
Thank you.
You're welcome.
David Samuel?
Hello, sir. Good afternoon.
Good afternoon.
How are you doing today?
Fine.
So are you aware of the test that you're going to be doing today?
Yeah.
Okay, alright. Here are some simple steps to follow in doing each of the tests. The first test that we're going to do, you're going to collect some urine in this container. You're going to collect the midstream of the urine. The midstream is the middle part of the urine. So you're going to urinate. Hello, you're going to urinate into the toilet and catch the middle part in the container. Then you're going to finish off the rest in the toilet. First, you're going to wash your hands and wash your hands with the soap that is provided. You're going to wipe your genitals with this wipe and pass the urine. Here you go.
Is that one?
Sir, thank you. As you can see, we're going to test it right away. And pay keen attention so you don't say put anything in it or anything like that. Okay, so we're going to set this aside for 10 minutes until the test results are ready. It is now 10:30, so by 10:40 we will check that. The next test that we're going to perform is the oral swab test. So here we have the swab, the collect. Next we have the oral fluid screen, and we're going to basically put this in your mouth and swab until the sponge is through. It is out. It has been out for 15 to, it is in room temperature for already 15 to 30 minutes. So we're going to stick it in your mouth. Okay, young man, open your mouth. Okay. We're going to sit this to rest for 3 minutes. In the meantime, we're going to do the hair follicle test. This is a sterile scissors that I am going to use to remove the hair closest to your scalp. We're going to send this test to a different lab. That's it, we'll call you back for your results. Okay, sir? Okay, sir?
Okay.
I am Erica Dyer and I will be presenting on handling of sample. There are 3 expectations and procedure when handling sample. All samples should be documented for identification with the patient's name, date, and time of collection. This will show for integrity. Information given on the sample and requisition should agree with each other. When labeling the container, the label should be placed on the body of the container and not on the cover, because the cover can accidentally place on another container. Therefore, this will be allowed for easy recovery. Also, if the container is used for both collection and transportation. Samples that are time-bound should be confirmed, checked for appropriate collection, handling, and transportation, verifying that the sample sent meets the need required. Oral fluid drug test. When conducting this procedure, a sterile swab stick is placed in the corner of the mouth and left for 3 minutes for saturation. then removed and inserted in a vial. The swab should be kept at room temperature if it will not be tested right away. If not, it should be stored on a fridge at temperature 2 to 8 Celsius. Transportation: the sample should be placed in a sterile plastic transport tube. Hair follicle drug test. When conducting this procedure, standard amount of hair, 1.5 inches of hair, cutting from different parts of the head to avoid bald. Using a stainless steel scissors, cutting near to the core as possible. The sample should be wrapped in aluminum foil. Place it in a small envelope, sealed with only glue on flap. Stored at room temperature in a dark place. When transporting the sample, it should be placed in a mailing addressed, stamped, sealed, large envelope with the patient's full name attached to it.
By the next week, David had a drug overdose, and as we could see from the aggressive behavior in the office, he was tested positive for cocaine, ecstasy, and marijuana.
So the clients were informed about their results, and now I will explain what these results mean. For a toxicology test, to determine a negative or a positive result, one must know the cutoff levels for initial screens as well as for confirmatory tests. It is also important to know the minimum detection, which is how soon, and the maximum detection, which is how long after drug is used that it can be detected. An oral fluid-based drug screen. Negative result means there was no unexpected drug found in the sample, and a positive result means unexpected drug was found in the sample. Conditions that may prove a false positive result is contamination with food or debris in the mouth, ingestion of poppy seeds, and ADHD drugs. False negative result can be obtained from oral care products and antihistamine and antipsychotic drug affecting the result. The hair follicle drug test can detect drugs within the last 90 days. A negative result means that you have not engaged in illicit drug in the last 90 days, and a positive result would have to be confirmed by a gas chromatography test. Conditions that may affect the result of the test. A false positive test can be derived from the color of the hair, as certain drugs tend to bind more to melanin in darker hair. Ambivalent exposure through secondhand smoke, and for false negative, hair bleaching or coloring. For the 12-panel urine screen, a negative result means that the drug tested for in that panel was not detected, and a positive result means the drug tested for in that panel was detected. Conditions that may prove a false positive. Antibiotics may cross-react with drugs, other medications such as metformin and ibuprofen. False negative, clients tampering with the sample by adding water and specimen to dilute, meaning the client consumed too much water before the test was done. A confirmatory chromatography test is done for the purposes of confirming or giving definitive results.
And how all this is important? It is used to monitor substance abuse problems, used in the business world, and also used by doctors to monitor their patients with severe health problems on their intake of a prescribed drug. It can also provide information and knowledge that can be used by agencies and others to put programs in place to identify and limit exposure to harmful substances. The toxicology can be used to determine if a doctor should either lower or increase the dosage on a prescribed drug due to the effects it is having on the body. If a patient is tested positive for illegal drugs such as cocaine and marijuana, further testing is done to determine the approximate amount, and if identified as a substance abuse problem, the individual would need proper care and monitoring. If someone is addicted to illegal drugs such as cocaine and marijuana, it can have a bad effect on the individual's body. These two substances are mind-altering compounds that can cause an individual's behavior to change for the worse. It can cause increased aggression, impulsive behavior, and also can cause serious health issues such as damage to the immune system. Marijuana and cocaine can cause paranoia and impaired vision if too much is in the body at once. This can cause individuals to get in accidents and in some cases suicide. If a test comes back negative, it does not always mean the individual is not on drugs, but it can mean that the drug was already processed by the body.
Thank you for watching our video. Get the facts all about tox.
Driver, don't stop at all.